Hi, my name is Melinda Coghill. I'm a co-founder here at i65. I'm here today to give you an overview of what Medicare optimization is, as well as what is the new i65 3.0. Are you ready? Okay, let's get started. Okay, so first, why Medicare? Let's start with the Medicare landscape. I'm not sure if you know, you probably do, but 3.6 million people turn 65 each year in this country and become eligible for Medicare. Among those people, 72% will willingly tell you, no, I don't get it. It does not make sense. So as they go through the Medicare enrollment process, what's very common is people make mistakes. What people don't know is how costly and permanent these mistakes can be. Just one can literally cost a person thousands of dollars a year for the rest of their lives and even keep them from getting needed healthcare services. Yeah, I'm not kidding. They're big. In fact, we tried to put our arms around, hey, how big is the Medicare mistakes problem in this country? So we ran an analysis. Through this, we determined seniors make about $6.4 billion worth of Medicare mistakes annually. Yeah, really. I'm not making that up. Just to prove the point, I'm going to tell you about two of our clients. These are real people, real scenarios, real mistakes. And don't worry, I'm only going to subject you to two. I could do these all day long, but I promise I won't. So just two. David and Sandy, a married couple. When Sandy turned 65, her Medicare card arrived in the mail. When David turned 65 6 months later, he waited for his Medicare card to arrive in the mail. But his didn't come, and it didn't come, and it didn't come. Finally, he got on the phone to Medicare and said, "Excuse me, can you please send me my Medicare card? I'm going to see a doctor, and I need it." They said, "Well, David, you never enrolled." "What are you talking about?" That's when David learned the difference. Sandy was already drawing Social Security benefits when she turned 65. Medicare for her was automatic. David was not yet drawing Social Security benefits. He had to take action to get enrolled in Medicare, but he didn't know that. David is now outside of his initial enrollment period. He has to wait for the general enrollment period, which happens January through March of each year. And then this will end in 2023. But still in 2022, Medicare coverage will not begin until July 1st, and he's going to pay a late enrollment penalty for the rest of his life. So what is he going to do for health coverage until Medicare actually kicks in? I don't know. And then again, that late enrollment penalty for the rest of his life. Okay, that's just one. This is the second one, and then we'll move on. This is Jane. When Jane was 67, she was still working for a large employer, never took action to enroll in any part of Medicare. For her, that was fine. The problem came when her employer said, "Jane, we're really sorry, we have to let you go." And Jane went on the company's COBRA coverage. To Jane, this was the same employer-provided coverage she had always had, just more expensive. Jane never thought about Medicare at all, never considered it. This was fine for her because she barely saw doctors, barely had anything happen to her for the first 10 months that she was enrolled in COBRA. She did what we call flying under the radar. Unfortunately, in the 10th month, she wound up in the emergency room. In that emergency room visit, she got a stage 4 cancer diagnosis. At that point, the hospital administrator came walking in and said, "Jane, do you know you don't have health insurance?" "What are you talking about? I gave you my COBRA card. I have COBRA." "Jane, do you have Medicare?" "No, because I have COBRA." "Jane, you don't have a primary payer." What? As soon as employer-provided coverage is no longer related to active employment, Medicare treats it differently. COBRA is secondary to Medicare. You have to enroll in Medicare in order to have a primary payer. But Jane didn't enroll. Jane is now outside of her special enrollment period. She has to wait for the general enrollment period, which happens in January. And again, for Jane, Medicare coverage would not begin until July 1st. Her emergency room visit happened in August of the year. She has almost an entire year of being the primary payer for cancer treatments. These are the kind of mistakes that people actually make in Medicare. These are retirement plan altering mistakes. They can devastate a person for the rest of their lives. Medicare mistakes are no joke. Yeah, so bottom line, mistakes. But why is it happening? Well, the reason it's happening is because we are literally forcing seniors today to become Medicare experts simply to enroll in the program. In fact, whenever a person's about to turn 65, they're going to automatically get a guide in the mail from the government explaining Medicare enrollment. Maybe you've seen it. It's called Medicare and You. Here's the thing. The 2022 version of this guide is 127 pages in length. Yeah, just a little bit of light reading. So if your client decides, you know what, I don't want to do this, where else are they supposed to turn for help? They often turn to the Social Security Administration, which makes sense because they're in charge of Medicare enrollment, premiums, penalties, etc. But Social Security by itself has 2,700 rules and thousands of codicils for those rules. But regardless of whether you want to talk about Social Security or Medicare, there's only one phone number. You get who's ever up next, regardless of what they know and often don't know about Medicare. Just as a rule of thumb, our clients on average, about 1 out of every 5 people who get in touch with Social Security just get flat out wrong information. So if Social Security isn't working for your clients, the Medicare and You book isn't working for your clients, quite frankly, where are they supposed to turn for help? Now here's the truth. Clients know they can turn to insurance agents or insurance companies. But that's not where they want to start because in many cases, seniors don't know if they can trust that insurance agent. It's a big deal. So first, if they don't have an insurance agent they know they can trust, they turn to somebody they already trust. Doctors, nurses, attorneys, CPAs, HR professionals, and studies have shown, if they have one, a financial advisor. Unfortunately, most of the professionals that they are turning to for help today still aren't helping. Which means if you are willing to engage your clients in a meaningful Medicare conversation, it's a huge opportunity for you. Huge. I'm not kidding. And our job here at i65 is to make it easy for you to do it. So, introducing Medicare optimization with i65.